I guess after listening to the testimony here and prior to coming to Congress in January, being a practicing primary care physician for 20 years, I would maybe start with Dr. Collins and say, what makes the Affordable Health Care Act affordable?
There's several insurance coverage expansions that will make coverage far more affordable for people than is the case today. So most people who try to buy on their own, as was mentioned earlier, don't actually end up buying a health plan through the individual market because they're underwritten on the basis of their health, and they actually face the full premium. Their health care conditions can be excluded from their coverage. So the new Medicaid expansion will dramatically increase coverage for people, as well as the premium tax credits, increasing coverage for people up to 400% of the poverty line. Jonathan Gruber did an analysis that he published in May that looked at how much whether health care would become more affordable for people, and the majority of people in the United States would find premiums and their out-of-pocket costs affordable under the Affordable Care Act.
Who's going to eat the cost? I mean, it isn't free to provide health care. You said 50 million uninsured, 70 million uninsured. I think the President talked about 30 million uninsured when this came into effect, so I guess it's grown by 20 million in the last year and a half. Who's going to pay for that? Where's that money going to come from? Who are they going to take it from?
Well, there are several offsetting provisions in the law that do pay for the expansion completely, and in fact save money over time.
So the taxpayer then? I mean, the government doesn't have any revenue other than tax, so the taxpayers are going to pay for it?
The provisions in the law require changes to the delivery system, changes to Medicare Advantage plans, bringing them more in line with regular Medicare.
Do you think health care is going to improve, or is the quality of care going to go down?
The quality of care under the provisions of the law is absolutely expected to increase.
How so?
The delivery system reforms are actually directed not only towards saving money, but also improving the way in which people receive their care, making the system more patient-centered, focusing on coordinating people's care over their lifetime and over a disease experience. So bringing much more rationality to the system than is the case today.
Mm-hmm. Dr. Holtz-Egan, I think you said Medicare is maybe one of the worst examples of management of an entitlement program.
I certainly think it's a clear fiscal problem. We know that. I mean, right now, the gap between premiums and payroll taxes coming in and spending going out is $280 billion a year. It's going to get worse, not better. It also promotes a lot of bad medicine. We have a Part A for hospitals, a Part B for doctors, a Part C for insurance companies, a Part D for pharmaceuticals. It's not integrated in any way. It's not coordinated around a beneficiary. It's hospitals are paid a fixed amount for a diagnosis. Doctors are paid for volume. Doctors practice in hospitals. The conflicting incentives are enormous. So I think reforming Medicare should have been the top priority, not something that was left behind.
Yeah, and right now, as Medicare patients will tell you, it's getting harder and harder to find primary care doctors. And so I guess you're disagreeing with Dr. Collins that where she says we can add more and more people to Medicaid, and yet we're going to maintain a quality of care, and somehow we're going to reduce cost.
The Medicaid expansion is the most problematic in my view. Medicaid beneficiaries are in ERs for normal care at far higher rates than are the uninsured, and they have a great difficulty finding primary care physicians. And to expand that program rather than fix it, I think was an enormous mistake. So, and just want to say on the affordability issue, there's a fundamental problem with a country that spends nearly 20% of its national income on health care and defines care to be affordable when it is under 10%. That can't add up.
And I don't think people in general want to look at it like a better homes and garden, good, better, best health care. I mean, everybody wants the best, but the best costs money. And we're saying this is an affordable health care act, but yet we're trying to increase the number of participants and we're trying to decrease the cost. Someone's going to have to pay for it. Ultimately, it's going to be taxpayers. It's going to be on the burdens. Physicians, we have an SGR problem right now for physicians where they're trying to cut another 29% from physician pay. As a primary care physician, I don't set my own fees. That was set by Medicare over a decade ago. We've not had an increase in 10 years, and they're proposing a 10-year freeze. I don't know what the incentive is going to be to other physicians to go into medicine to help expand this improved quality of care that Dr. Collins spoke of. But my time has expired, and I thank you for your input.